Liver on ultrasound is always convenient because it is lying right adjacent to the chest wall and in the epigastrium right adjacent to the probe, to the anterior abdominal wall. It is adjacent and the probe is lying on top. In the epigastrium, we can place the probe directly upon the liver, while that segment, the right lobe, which is behind the rib cage, we can always see it through the intercostal spaces. And very interestingly for our trainees, we consider this portal venous branching pattern just like a running deer. You can see the neck of the deer, the anterior leg and the hind leg, the tail. This is the neck, this is the body of the deer. And you will appreciate the gallbladder, which is riding the deer. And sometimes it appears as a squirrel with a bushy tail, the gallbladder. We will show you in a moment. Longitudinally, there you see the portal venous branches and how it appears on cross section. And there on top is the ligamentum teres, this white thing. And there you see the gallbladder. So with the help of the portal vein, we divide the liver into 4 main segments. This is the neck of the deer. If we draw a line parallel to it, this is the left lobe. Behind the deer, this one is the caudate lobe. Between the neck and the gallbladder, this one is quadrate lobe. And here is the right hepatic lobe. So we will say this in a moment. The probe is placed in cross section in the epigastrium along the right costal margin, which we will show you on real time on patients. There you see a running deer. I will share. Sorry. There you see the running deer. You can see the neck of the deer, the front leg, the face, the horns, the body there. You can appreciate the tail and the hind leg, and this deer is running nice. This is it. The neck, the face, the horn, the front leg, and this is the rest of the body. You can appreciate the tail and the hind leg. This is how we see the different lobes of the liver. Behind the chest, you can see a white line of ligamentum venosum dividing the left lobe from this caudate lobe. This is also the first segment, the segment number 1. And this is the left lobe having two segments, 2 and 3. And here is the quadrate lobe, the segment 4, so on and so forth. There we are. This is a space occupying lesion in the liver, and inside you see a lot of debris. And there is a feature of ultrasound called posterior wall enhancement, the bright posterior wall of any cystic mass. You can appreciate this collection, and posteriorly, the wall and the parenchyma, all is very bright. We will discuss these biophysical aspects of different appearance of tissue behind different cystic lesions. So this is how an abscess in the liver will appear with debris particles inside. There we are, an abscess in the liver. You can appreciate some blood vessels inside which are thrombosed. These blood vessels which are thrombosed, you can see the two walls of these vessels. So we will continue with the liver after a 10-minute break. So you can have tea, and we will, please don't go away. We'll keep the link on so that you don't have to join us again. Keep the link on. A 10-minute break. Okay. देखें शेयर करना है. जी. बिस्मिल्लाहिर्रहमानिर्रहीम. अस्सलामु अलैकुम. ये वही लिवर आप देख रहे हैं जी. और इसमें जरा देखें, गॉल ब्लैडर वॉल इज मार्kedly edematous, and you look at the deer sign. The deer is there like a small squirrel, and look at the skin of the body. It is markedly edematous, white and bright. So when there is this edema of the portal venous walls, as you can see here, this will be this we will find in acute hepatitis. आवाज आ रही है जी मेरी? अच्छा. This we will find in acute hepatitis, and this is called periportal edema. Periportal edema. Look at the gallbladder wall, which absorbs the edema from the edematous inflamed liver capsule, and thus becomes markedly edematous. There is very little bile inside because liver is acutely inflamed, and very little bile this liver is producing at the moment. So this is how you see the deer, or you can see a squirrel with a bushy tail of gallbladder. So this is how we see in periportal edema due to acute hepatitis. Whenever we come across malignant growths, whether primary or metastatic, in the liver parenchyma, we find that these growths, as you can see this bright growth in the liver, they are always surrounded by a black zone, a black halo all around. You can appreciate a black zone all around. This black zone all around, or halo, is a sign of invasion and infiltration all around. So, malignant growths will have a halo, a black halo all around. Look at this as well. There you see multiple metastatic deposit, and each is surrounded by a black zone. So malignant growths, they have these black infiltrating halos around. It is difficult at times to see the halo around a malignant growth. So in those situations, we must keep this in mind, that we should not increase the gain of the brightness, the density, intensity of the beam to such an extent that the halo become obscured by the increased brightness. If you closely look at this very small bright nodule, which is malignant, it also is surrounded by a black halo. This tumor is again surrounded by a black halo.